Okay, so here we go with Chapter 21, which is Diseases of the Skin and Eyes. This chapter has lots of really, really bad pictures. I'm going to spare you having to see those pictures, but I would definitely encourage you guys to look over the pictures and just kind of get yourself ready for some of the horrible things you're going to see. You know, once you get into your program and you start working with patients and all that. But I just didn't want to include the pictures in the PowerPoint because obviously none of the pictures will be on the test, and there's no sense of having to, you know, gross you out too much here. But certainly take a look through the chapter and get an idea for how awful some of these diseases really are. So here's a very benign picture. So this is a picture of a cross-section of the skin. This is something that you certainly should have seen in A&P1. Not going to really test you on this because, again, it's A&P1 stuff, but certainly you should remember that the outermost layer of the skin is called the epidermis. Then the big, thick layer with all the blood supply and nerves and hair follicles is the dermis. And then the hypodermis is also called the subcutaneous tissue, and that's made up of adipose or fat tissue. And of course we have the hair follicle, sebaceous glands, which we've talked about already when we were talking about how the skin is the first line of defense, and sweat glands. Again, same thing. Sweat, oil, all helps to prevent bacterial growth on the skin, which is very important to keeping the skin healthy and not getting infections. So here we go. The salts and oils on the skin inhibit microbial growth, which is very important. We do have some species of Staphylococcus that live on our skin and are totally harmless. Some of them even help to keep the bad bacteria away. So it's an example of mutualism, where we give the bacteria a place to live and then they help protect us from the more dangerous bacteria. Areas of the skin with greater moisture contain more bacteria. That's what body odor is. So basically there's certain bacteria that live on our skin that feed off of our sweat, and when they feed off of it, they basically release these chemicals that stink, and that's what body odor is. It's from the bacteria feeding off of the sweat on your skin. And then, of course, there's other types of bacteria that can live on the skin that can give us problems, and also that can cause acne. So we're going to talk about all these different issues and problems that mostly bacteria can cause with the skin, and then there will be some other things we'll talk about here at the end. So here's your list of vocabulary words, so make your flashcards. Vesicles are small fluid-filled lesions. Larger ones are called bullae. Macules are flat, reddened lesions. Papules are raised lesions. And when they contain pus, they're called pustules. Xanthem is a skin rash from a disease. Enanthem is a rash on the mucous membranes from a disease. So, you know, EX or exo means outer, and then EN or endo means inner. So that's why it's xanthem and enanthem. Folliculitis is infection of the hair follicles. So again, just make your flashcards. I'm trying to see. I know that the Patho book has nice pictures of these. Yeah, so on page 582, if you want to see an actual picture of vesicles and macules and papules and all that kind of stuff, then go ahead and look at the picture on page 582. It's like a cartoon picture, so it kind of gives you an idea about how these things differ from each other. So staphylococcal infections can be all kinds of different things. So first thing can be just a very, very superficial skin infection from the normal Staphylococcus that lives on our skin. It could be something as simple as a small pimple would be considered basically like a very small staph infection. Also, of course, anytime that you have cuts or burns or injuries, anytime the skin is compromised, you have to worry about certain species of staph and strep getting into that cut or getting into that wound and infecting it. So we've already talked about Staphylococcus epidermidis in lab. That's the one that's the very, very common one that's found on our skin and really does very, very little to hurt us. But Staphylococcus aureus is much more dangerous because it can cause very bad skin infections. It can cause wound infections, especially in hospitals. And then that's what MRSA is. So MRSA stands for methicillin-resistant Staphylococcus aureus. So it's a highly antibiotic-resistant strain of Staph aureus. And it's very, very dangerous, very difficult to treat, and it takes a very long time to get better from it. We already talked about Streptococcus pyogenes. That's what causes strep throat. That type of strep bacteria is called beta hemolytic because it actually feeds off of red blood cells and destroys them. So we've already talked about before how dangerous strep pyogenes is, and certainly it bears repeating here. So folliculitis, which we already talked about, is infection where the hair follicle is, and it often presents itself as a pimple. A stye is when you have folliculitis of the eyelash, and again, these are all usually Staph aureus is the culprit. Not all the time, but usually if you're going to have anything that's a little bit more serious than just a simple little pimple, it's usually Staph aureus. A furuncle is a type of abscess. It's also known as a boil. This is basically just a really, really super large, painful pimple is basically what it is. It's just very, very big. And you wouldn't even call it a pimple because it's so big. You would call it an abscess, a boil, or a furuncle. So it's a localized region of pus around inflamed tissue, and then if it goes untreated and causes extensive damage, it actually leads to something called a carbuncle. Impetigo is a very severe skin infection when the skin vesicles actually rupture and crust over. Usually impetigo is a big danger for newborn babies because their immune systems are not equipped to deal with the outside world quite yet. Their immune systems are still developing, and they get this really, really bad skin infection. And again, that's why it says very troublesome in hospital nurseries, because you get lots of these little babies around each other, and it can cause some major issues there. So it's kind of like a more severe version of impetigo is called scalded skin syndrome, a very severe skin infection where the skin peels and sloughs off. Another problem for newborns, very young children. And then toxic shock syndrome is when the toxins produced by bacteria cause a systemic life-threatening condition. So essentially this list, it's stuff that you want to know for the test, but it's a list that just gets worse and worse and worse and worse as we go down. So things that Staph aureus can do, starting with, probably the most benign, the least serious of all the way down to the absolute worst thing it can do. So if you kind of remember these things in order of how bad they are, it may help you remember what they are for the test. So, of course, we know that Streptococcus pyogenes causes strep throat, but it also does other things. So, another thing that it can cause is called erysipelas. Erysipelas is infection of the dermis, so that's that very thick layer of the skin. The skin erupts into reddish patches with raised margins, and if it continues, the bacteria can get into the bloodstream and cause very severe sepsis. Strep pyogenes, again, a very, very bad bacteria. It can also cause impetigo, similar to what we just talked about with Staph aureus. It can also cause toxic shock syndrome, again, similar with Staph aureus. This is why, gram staining is so important, because you're definitely going to want to know if someone has any of these skin issues. You're going to want to know whether it's Staph aureus or Strep pyogenes, because you're going to treat it a little bit differently. And then other strep species can become flesh-eating bacteria, which is obviously another very, very severe skin issue. That's why we're including it here. But yeah, definitely not a bacteria to mess with. That's why I always say in class, if you ever get diagnosed with strep throat, get those antibiotics and get it taken care of. Don't let it go on for a couple of days, because it can travel to other parts of your body, including the skin. We worked with Pseudomonas in lab before as well. Pseudomonas can cause some issues with the skin. So dermatitis is a rash associated with swimming pools and hot tubs that we usually get from Pseudomonas. Otitis externa is swimmer's ear, a very painful ear infection, usually caused by Pseudomonas. And Pseudomonas is definitely an opportunistic bacteria in hospitals, so it can cause a vast array of nosocomial infections. Two types of patients that it really goes after is patients with cystic fibrosis and patients that are in burn units. So certainly other people are in danger anytime you're in the hospital from this type of bacteria, but certainly people with cystic fibrosis and burns are especially targeted. So I'm going to go ahead and wrap up right there, and then we will pick up with the next slide.